As you listen to this speech, take a second and think about how addiction affects your life or the life of someone that you know. It does not have to be something as serious as the topic today, which is opioid addiction. It could be anything someone's addicted to: online shopping, nicotine, alcohol, working out. Addiction is anything that affects someone's everyday life that they really struggle living without. In order to lower the amount of heroin addiction starting with the youth, America should adopt my policy of following the lead of other countries who have reduced this problem. First, I'm going to talk about the last speech I went over so everybody will know what is going on. Second, I'm going to go over the plan and policy which I believe should be implemented in order to change this. Third, I'm going to talk about the evidence on why this will work. And finally, I'm going to talk about people's concerns and give them reasons of why this will work. Just as a refresher for the information from last time, I talked about how the effect of opioids on high school students is something that many people don't think about unless it affects their everyday lives. The definition of an opioid, which we went over according to drugabuse.gov, is a class of drug that includes the illegal drug heroin, synthetic opioids such as fentanyl, and pain relievers available legally by prescription such as Oxycontin, hydroquine or Vicodin, codeine, morphine, and others, and how it is supposed to be used for pain. Second, we went over on how opioids start when you're young, and it does not matter where the person is from or where they're living. Third, we talked about how it escalates from something minor, like an over-the-counter prescription, to something major, like heroin. Now that everyone has a reminder on what we talked about last time, we can now move on to policy which needs to be implemented by the U.S. government. The policy I'm trying to have implemented would be the decriminalization of all drug use in the United States, but to start, it would only be opioid use. Portugal started using this policy starting in 2001, when they were on the brink of heroin addiction for not just one area, but the whole country. The decriminalization will mean it is still illegal to take it, but they will only receive a fine and then have to go speak to doctors and social workers to try to help them. Safe injection sites will help lower the diseases being passed around by sharing needles, but will be placed in areas where the problem already exists, not in new areas where it's not already there to make families feel unsafe. According to an article on NPR.org, after a 2-year battle, the Philadelphia nonprofit Safe House says next week it will open the first space in the U.S. where people struggling with addiction can use opioids and other illegal drugs under supervision of trained staff. That article came out in late February, so this site is already up and running. The plan for funding these places will be that the sites of the legal injection sites will be nonprofit areas, so the people working there will not be paid or will be paid by an outside source. The sites will be funded by taxpayers' money, and they will also accept donations from people. The areas where these sites will be set up will be rundown neighborhoods that the problem is already present. So they will have cheap property, so it will not cost too much to set it up. The enforcement of this plan and the decriminalization will fall on the police and not sending them to jail, but instead taking the information and giving it to others to administer fines and then have them sent to social workers to have them helped out. With this policy in place and everyone's support, a dramatic change can be made for the country and the people living here. The ability to reduce the deaths of the opioid is something that has been seen and proven in Portugal. According to the New York Times article, a new Portuguese law eliminated jail time for possession or use of small amounts of any illegal drug and instead sends drug users to a panel of experts who provide assistance. Jail sentences have been replaced with mandatory counseling or treatment and possibly community service or a fine up to $130. The panel consists of a psychologist, a social worker, a legal advisor, who will then decide what action to take. This policy will not completely stop the problem, but it will most likely make it stagnant, which will allow for the start or decrease in these areas. Limiting the use of opioids in the youth of these areas is also going to benefit from this. According to transformdrugs.org, which conducted surveys in Portugal, drug use has declined among those aged 15 to 24, and the population, which is the population most at risk for initiating drug use because of the policy. People often have concerns about dramatic changes such as implementing my new policy. Portugal became the first country to decriminalize the possession and consumption of all illicit substances. The opioid crisis soon stabilized, and the ensuing years saw dramatic drops in problematic drug use, HIV and hepatitis infection rates, overdose deaths, drug-related crime, and incrimination rates. HIV infection plummeted from an all-time high in 2000 of 104.2 new cases per million to 4.2 cases per million in 2015. The death rates in Portugal have dropped drastically because of the monitored use and the help which they are providing people. Some drawbacks that people say that could happen in the policy would be that are already seen in the site in South Philadelphia. James Powler, a South Philly resident who has already been recovering from drug use, says that he was bamboozled. Heroin is illegal, and he has 3 kids. Yes, I'm a recovering addict, but this is affecting my life. People find that in South Philly already that they feel more threatened because these outside people who have known problems are coming in their neighborhoods where their kids play, which is why I think that is important that we keep it in the neighborhoods where the problem already is, such as Kensington. I believe that the United States of America should follow my policy to help resolve the very real problem of opioid addiction and death from addiction which we face in this country. In order to lower the amount of heroin addiction, starting with the youth, America should adopt my policy of following the lead of other countries who have reduced their problems. The use of safe injection sites will allow professionals to monitor and help treat people who are already addicted instead of just letting them die on the street. Decriminalization will also not just send these troubled people to jail, but find them the help that they need to become better. If my policy is put into place, it could save the lives of someone you may know or someone who you do not know yet, but could have an impact on your life forever.